good to talk about empathetic statements and connecting with the patient. This is something that's often overlooked in medical education, and it's really important for developing rapport with the patient and, um, again, for OSCEs and other standardized assessments. So let's start. Empathy, what is it? It's the ability to relate to the emotions of another. It's, like I said, very useful for building rapport with the patient. Sociopaths and ex-girlfriends lack it. So here's a good one. I'm sorry that you are feeling poorly. This one seems obvious, but it's a good way to convey empathy. I like it because you can use it right when you meet the patient. For example, you ask the patient, what brings you in today? The patient says, I've had this nagging cough. I'm sorry to hear that you are feeling poorly. And then as a bonus, you can say, let's work together to get you feeling better. Tell me more. This is like the jack of all trades. This encourages the patient to tell their own story and to give more details without you kind of steering the conversation. It's a good way to make the discussion patient-centered and open-ended. This is good for step 2 CS. So if the patient says, my stomach hurts, you say, tell me more about that. The patient says, I'm hearing voices. You say, tell me more about the voices. I'm sorry to hear that. This is a good response to an empathetic cue. If the patient says that their dad died of colon cancer, you say, I'm sorry to hear that. If they say, my dog died, you say, I'm sorry to hear that. As a bonus, you can say, how are you feeling right now? Again, this conveys empathy and that you're engaged with the patient and what they're telling you. You want to, or what you don't want to do is they say something like, oh, my dad died, and you just say, oh, okay, and ask the next question. I can only imagine how difficult it has been. This is nice because it relates to the patient. It's particularly useful when the patient is very emotional or upset. For example, the patient's upset that her back pain isn't improving. I can only imagine how difficult it has been. And as a bonus, let's try to find some solutions together. Yay! How has this impacted your daily life? I like this one because it demonstrates concern for the patient, not only as a patient, but as a person. And it helps you understand the severity of the disease. So if the patient says, I've been having difficulty swallowing food, you say, I'm sorry to hear that, as discussed previously. And then you say, how has this impacted your daily life? To have the patient elaborate more on their symptoms. Again, these are just a few of the empathetic statements that I can think of off the top of my head. They're good to kind of drill into your brain so you automatically say them in response to the empathetic cues that the patients give. So hopefully this is helpful for all of you medical students out there. And hopefully no sociopaths watching this video trying to learn how to be normal. So, all right.